Today I will be talking about the anticholinergic drugs classification, and the part this will be the part of the autonomic autonomic nervous system pharmacology, and I have already talked about cholinergic drugs and adrenergic and anti-adrenergic drugs. So I hope you have been through those videos, and this will be the fourth classification of this autonomic nervous system pharmacology. Pharmacology. So this is classification of the anticholinergic drugs. Anticholinergic anticholinergic drugs. That means it lyses or antagonizes the actions of this cholinergic drugs or cholinergic action of the parasympathetic nervous system or neurotransmitter acetylcholine. This is the meaning of this name. Now these anticholinergic drugs also known as atropinic drugs, because in this category atropine is the prototype and one of the important and major drug of this category, atropinic. So this is also known as atropinic drugs or, and these drugs will basically act on the muscarinic receptor and block those receptors. Although these drugs may have some uh, nicotinic anti-nicotinic action too, but the main action will be of anti-muscarinic type. So also known as muscarinic receptor antagonists, or you simply call it as anti-muscarinic drugs. Anti-muscarinic drugs or these drugs are lysing the or antagonizing the action of parasympathetic nervous system, hence it is also known as parasympatholytics. Parasympatholytic drugs. So remember, uh, sometimes in MCQs you might be asked as like which of the following is the atropinic drug or muscarinic receptor antagonist or anti-muscarinic drugs or parasympathetic drugs, or simply in classification if you ask to write short note or short questions, you will be asked like classify the atropinic drugs, or any of these terms will be used. So not always like you will be asked that classify the anticholinergic drugs. These are the synonyms, so you have to remember the synonyms of these drugs. So classify these drugs. Now classification, move on, proper classification. Okay, I will not make the chart, I will simply write as numbering. First category is natural alkaloids. Natural alkaloids. This category are very important. Very important. The examples will be atropine, very important drug, atropine and hyoscine. Atropine and hyoscine. This hyoscine is also known as scopolamine. Scopolamine. So I have a short mnemonics for these categories of drugs. Please remember at NASA. This is not American agency. What you know, NASA. Here, this NASA stand for Na, natural alkaloids, as will stand for scopolamine, H, hyoscine, and A, atropine. This is the natural alkaloids. And from this category, very important MCQ and Viva question are frequently asked. Like this atropine is antidote for organophosphate poisoning. OP poisoning. These organophosphates are the drugs, are cholinergic drugs. I have talked in detail in the cholinergic drugs classification. For example, diazinon, malathion, parathion, diflus. There are many other examples also. So in that case, in this poisoning, OP poisoning, this atropine is the antidote. And this atropine also I would like to mention, this atropine is obtained from since it is alkaloids, natural source from Atropa belladonna. Or Datura stramonium. From this species of plant, these drugs are obtained majorly. So sometimes that might be asked in Viva and MCQ too, that what is the source of this atropine. Now hyoscine is again very important drug. This is the drug of choice for motion sickness. I hope you know the motion sickness. Motion sickness means vomiting during traveling. In that cases, this is the most effective or you call or best drug of choice. This hyoscine. This hyoscine will be. And here debate arises from promethazine. You may know this promethazine. This promethazine is antihistaminic drug. That is, it blocks H1 receptors. So some authorities believe this promethazine is the drug of choice for motion sickness. Yes, somehow they are also right, because this promethazine, this hyoscine can be only effective if used prior to onset of the vomiting, if used prior to onset of the vomiting. But once vomiting has started and then you will use this hyoscine will not be effective and will not inhibit the vomiting effectively. So in that case this promethazine is very effective, and this promethazine is effective if you use earlier before the onset of the vomiting, or once the vomiting has started. In both condition this promethazine will be effective, So in that sense the authorities also believe this promethazine can be also the good drug of this for motion sickness. But for efficacy, if you compare efficacy, this is very efficacious, far more efficacious than this promethazine for motion sickness. Hence this is selected as drug of choice for the motion sickness. But the limitation is that once vomiting has started it will not be effective. So okay, I will talk in detail about this promethazine and hyoscine for motion sickness, why and how, which are better and which is more effective. I will talk in detail subsequent lecture. But please remember at this moment, if you ask drug of choice for motion sickness, please answer this hyoscine. And if you ask there is alternative to, then you can add this promethazine. And if you ask why that, so mention these reasons, and some specific reasons I will mention in subsequent lectures too. So these are all about the natural alkaloids. Now I will talk about semi-synthetic derivatives. Number 2, semi-synthetic derivatives of this anticholinergic drugs. These include atropine methonitrate, homatropine or homatropine. Then there will be hyoscine butyl bromide, Then there will be ipratropium bromide, tiotropium bromide. These ipratropium and tiotropium bromide, these are the very effective drug used in the COPD patient, chronic obstructive pulmonary disease. Ipratropium is the older congener and this tiotropium is the newer congener. So please remember here also, short mnemonics at this is like this, this is IT seminar. This is IT seminar. This A stand for atropine methonitrate, H homoatropine, another H hyoscine butyl bromide, I stand for ipratropium bromide, and T will stand for tiotropium bromide. And this seminar, from this seminar, this semi will stand for semi-synthetic derivatives. Semi-synthetic derivatives. This is the mnemonics. You can make your own mnemonics too. Now we will move on to the synthetic derivatives. Synthetic derivatives. Number 2, this will be number 3, synthetic derivatives. And this I am taking the reference of this classification from the K.D. Tripathi, Essentials of Pharmacology, 8th edition. So you can refer that textbook. Synthetic derivatives. Here, first category will be Medriatics. Medriatics. Again, dear friend, why you need this much classification? This classification, first all, this will be easier to the understand about the characteristic, usage, and adverse effect of a particular group of the drug. Besides, rather studying all characteristics in individual topic, individual drug. So this will be the first aim. Next aim will be, according to these categories are according to the usage, adverse effect, because of a particular class or category, most of the usage and adverse effect will be similar. However, they may possess few different usage and adverse effect too. So Medriatics, this is Medriatis, this derived from the Medriasis. This Medriasis, what is Medriasis? Medriasis is the dilatation of the pupil. Dilatation of the pupil. So these will include dicyclomine, okay, remember here mnemonics, my cycle tour, my cycle tour. So this will stand for Medriatics, cyclopentolate, and T will stand for tropicamide. Remember the mnemonic. My cycle tour, that is Medriatics includes cyclopentolate and tropicamide. Next derivatives are number 2 is the vesicoselective. Vesicoselective, as the name suggests, these drugs will act on the mainly urinary bladder, and in that case, in urinary frequency and urgency, these drugs are frequently used to reduce the motility, movement, contraction of the urinary bladder. or hyperactive urinary bladder. So this will include again here remember one mnemonics, that is favorite student deserve deserves the vote. Let's suppose in your school there are different student unions, so and there will be different participants for different posts. So to whom you will choose? The neutral person what tells that favorite student deserves the vote. So here F will stand for flavoxate. S will stand for solifenacin, and D will stand for darifenacin. B will stand for basicoselective O oxybutynine, and T will stand for tolterodine. So these are the basicoselective anticholinergic drugs. Now other categories. Category 3 will be anti-Parkinsonian drugs. These anti-Parkinsonian drugs, there are many anti-Parkinsonian drugs. Among them, few of the anticholinergics can also be used as anti-Parkinsonian drugs. That include trihexyphenidyl. This is also known as benzhexol. Then next will be procyclidine, and another is the biperidine. Remember here also a mnemonic at BPT. Anti-Parkinsonians here is also P, so anti-Parkinsonians and here BPT does not stand for Bachelor in Physiotherapy, but rather it will stand for B biperidine, P procyclidine, T trihexyphenidyl. And there are one more categories in synthetic derivatives. Fourth category will be anti-secretory, anti-spasmodic, spasmodics. See the name, whichever is correct. As the name suggests, this will what this category of the drug will do, reduce secretion and spasm. This secretion and spasm are the parasympathetic action, cholinergic actions, so it will antagonize that actions. So again here further there is further category. One is the quaternary compound, quaternary compound, and next will be tertiary amines, tertiary amines. Why I am this classifying this minutely? Because uh, this category I already mentioned what it has significance. This and again here this tertiary amine is the compound that can cross blood-brain barrier and reverse the central action of the cholinergic drug, or it has central anticholinergic action. But these quaternary compounds cannot reverse the central cholinergic actions, or it cannot have central anticholinergic action. Means in higher dosage this will also may have the anticholinergic actions, but at normal condition this is more blood brain barrier crossable than these quaternary compounds. So remember here examples. Here also here again remember on mnemonics that GIC cement, GIC cement pocket, GIC cement, or this is GIC cement pocket. If you are dental student, you must be knowing this GIC, which is glass ionomer cement, or type of cement that will used in the various purposes like restoration, uh, restoration in base, as base, many use this GIC has. So here this GIC will not stand for the glass ionomer cement, but rather it will stand for G for glycopyrrolate, glycopyrrolate. Again this glycopyrrolate is the important pre-anesthetic, like before giving anesthesia these drugs are used. Pre-anesthetic medication, or during anesthesia period also used during anesthesia. I will talk the uses in detail of these or all drugs in subsequent lectures. So some important point only I am mentioning here, because this might be asked in MCQ and Viva. This glycopyrrolate, yes, glycopyrrolate and isopro isopro isopropamide, I, and the C will stand for cimetropium, cimetropium, cimetropium bromide, cimetropium bromide. One C will stand for this C, clidinium, and this P will stand for uh, propenthelin, and O will stand for oxyphenonium, and this QUA for quaternary compound, and here is the tertiary compound. This category include um, dicyclomine, then remember PVT, private depot, private depot. This is private depot. Let me make a sentence. This is private depot. So P will okay, D I dicycloman, T will stand for tertiary, B will stand for and P will stand for pyrenzipine, and B will stand for S, valethamate, valethamate. So these all are anticholinergic drugs. Thank you for watching.